There are so many amazing women out there doing amazing things. And when women uplift each other, who knows what can happen? Well, welcome to Women in Business, and I am with a very familiar face, somebody that I am lucky enough to say I know personally, Dr. Wendy Sadoff. You are based in Farmington Hills, and you are classified as a dermatologist, right?
I am. I'm a board-certified dermatologist.
Okay, so how long have you been doing this?
35-ish years.
Really?
Yes.
Okay, so how did you start?
So I've been practicing as a dermatologist for 35 plus years, but I've been in my own practice for more like 14.
Okay.
So I started out when I was first, done with residency. I worked at Henry Ford, and I had a clinical and administrative position there, and that was great. It was 10 years, and then I was in a private practice with someone, not as a practice owner. And then at the ripe age of 50, I decided, if I'm going to do this, you can't go back and do it earlier, and there's no point in waiting. And I decided to just hang my own shingle. What's old is new again,
Right.
basically. And everyone was saying, that's not done. It's really hard to do. And I really, pushed ahead, and best thing I ever did. It was great.
That is awesome.
Mm-hmm.
So you did that, you said 14 years ago?
Right.
Okay, so 14 years ago. And, obviously skincare, you see TikTok, you see all of these trends, right?
Right.
But how do you figure out what is legit or going to work? Because everyone has different skin textures and tones and
Right.
issues.
A lot of things are not legit. I mean, these are, for the most part, and there's a mix. There are really credible people on social media, but there are also people that are just selling things, or something worked for them, or it's a gimmick. So how do we know? I mean, that's what I studied my whole life.
Mhm.
And, what is based in science, we rely on research and, colleagues coming together, and so that's how I know whether something is real or not.
Right.
It doesn't mean that someone can't have fun and try something and see if it works for them, as long as it isn't, dangerous or potentially harmful to their skin or health in some way. But buyer beware, as you flip through or scroll through.
The doom scrolling at 2 a.m., right?
Yes. But there are, I'm on social media, and I'm
Mhm.
trying to not only have fun, which my staff gets me going, doing
Mhm.
different things, but really try and educate people. It's a really great way to get information out, and we can't be last to the table, basically.
Right. Okay. So what is, if there was one topic that you thought was so important that everyone should know about when it comes to skin, what would it be?
Oh, easy one,
Okay.
protection from the sun.
Okay.
Yeah.
That's what I was thinking.
Yes, exactly. We're still seeing so many skin cancers, and we really didn't have good sunscreens when we were younger. We didn't have the awareness, but now we do. And although, I'll still pay for the indiscretions of my youth in terms of sun exposure, you know, if people are really, younger people are really diligent with
Mhm.
sun precautions, they're going to have a different incidence of skin cancer and aging. So sometimes when I'm talking to a young person, I
Mhm.
can't say, do this because you'll minimize your risk of skin cancer. I can say, do you want to look older than your friends?
So you have to
It just
reframe
depends
it.
what will, work. But
Right.
aging and skin cancer, both largely a result of sun.
Okay. And that is like the most important thing because
If you do nothing else. I
Okay.
mean, I'd rather see someone go to bed with their makeup on than go out during the day without sunscreen.
Right. Okay. So it's that important.
Yes.
Okay. So do you see kids, men, women, everyone?
I see everyone.
Okay.
Like from newborns to
Really?
103 I saw last week. Yeah.
Wow. Okay.
Yeah.
So what is the issue? Like, let's talk about teenagers. Acne, of course, I think is probably, how prevalent is that?
It's still really prevalent. And the interesting thing about it, there's just so much that is still, where people aren't aware of how much we can do, and also of the negative impact on teens
And the confidence,
having,
right?
oh my gosh, and the conflict between their parents related to the acne or treatment of the acne. Maybe they'll get to the dermatologist, but then the patient won't be using the medication, and then the medication was expensive, and then the parents are mad, or there's just a lot of conflict and emotion, and issues surrounding acne, and yet it's one of the most rewarding things we do. And it requires not just a basic knowledge of acne and what's out there, but there just so much about the condition, and then getting to know the patient so you
Like trust,
understand
yeah.
the nuances. What if they're a football player? A lot of the issue might be friction from the helmet or sweating. I mean, just the more you get to know them, the more you're going to understand what's going to work best for them.
Right, and their conditions,
Mhm,
right?
mhm.
To their surroundings, I
Right,
guess.
right.
So my daughter does have acne,
Okay.
and obviously me and her dad are divorced. So any medication, it's funny you said that, because any medication I get,
Right,
it's like, okay, well, can I have two so she can
right.
have one at each
That's the
house?
best. I love when we can just get two, or
Simplifies everything, but it's not always
right, because
possible.
otherwise then it's another responsibility for that teen to be taking the medication back and forth,
Hmm.
and another potential conflict. So we
Do you have any advice? Because there's some instances where you can't, like insurance won't fill it,
well, you
right?
really only get enough for 1 month, but maybe at the end of that month you might not really be ready for another one, but you could get your next month kind of ahead of time a little
Okay.
bit, something
Like,
like that. Or I mean, you really want it in the original container, but maybe you have a container from one that is empty and you could kind of split it,
okay.
or if you were really good with labeling or something like
Right.
that. But there's a way to have your supply at both, and make it easy. Anything
Right.
can make it easier
And
for
it
them.
is, but it is so stressful, and it's amazing
Hmm.
because I feel so bad for her,
Hmm.
and I am sure, the whole confidence.
Right. And it's not directly related to how severe the acne is. So there may be one teen with a couple small blemishes, and they may want to stay home from school, and they may not be taking a certain class because they have to get in front of the class. And another kid could have a lot of acne and it doesn't seem to affect them. And then there are kids that have a lot of acne, say it doesn't bother them,
But it
but
does.
it is impacting their choices, in terms of friends and how outgoing or
And
what
if they join
socials.
clubs or something, right?
Exactly, exactly.
Okay.
So we always assume it's impactful
Okay.
and treat it. And if there's no other reason to treat, it's because the scarring from acne, even though I have every laser and method to treat scarring, it's never as good as if you didn't have the scar.
Right.
So the acne may not bother this really popular football player, but maybe when he's 28 and he's in the business world and he has a lot of scarring,
Hmm.
you know,
That's interesting. So
so
it's
think
impactful
ahead.
even, yeah,
Hmm.
later in life,
Yep,
right?
yep,
Okay, so that's the teenagers. Okay,
that
so
is.
now what about people heading to college and, kind of taking their stuff with them, and in that whole realm of maybe they're drinking a lot now, they're doing things that aren't
Still
super
acne and
healthy.
self-care, but a lot of kids have, I mean, other skin diseases, eczema, seborrhea. I mean, and they need to kind of take care of that because these things are going to flare under stress.
Okay.
And your mom and dad are not there telling you to, use your medications.
Hmm.
So it's self-care,
And being
and
responsible, I guess,
yes,
right?
yes. So we have fun. So the day after Thanksgiving is our big day for kids coming home from college.
Okay.
So we don't see anyone. If someone happens to be there that's not a college student, they slipped in by accident. So we wear our college jerseys and we just see these kids, and it's so much fun. And we're just making sure, where are you at? What do you
Yeah,
need?
that's awesome.
Do we need to pivot in terms of treatment? So
Right.
it's probably the first time a lot of them, have an opportunity to get to the doctor.
Right.
Hmm.
Okay. So, and then even when you're an adult and you are, there's so many products out there. And I
Hmm.
know that I have switched between certain
Uh-huh.
ones. And then you're like, well, how do I know this works? How do I know this is the right one? I
Right.
mean, what is your number one piece of advice to
You know,
figure that out?
of course it would be to listen to your dermatologist, because I think, it's overwhelming. It used to be that the department store was overwhelming, but the drugstore had few products and you could
Hmm.
just go to a brand you had heard of and you'd
Right.
be okay.
Or maybe
Now
ran a commercial, right?
right, the drugstores are overwhelming
Yeah, it's
and the
crazy.
price point is really high. So we see our patients and we'll say, a combination of drugstore, and then I really believe in medical grade products. I think you're going to get better result, more focused, directed treatment. So we kind of have a combination, and kind of stay away from the department stores
Okay. And then how about men? Do men come in and see?
all the time.
Really?
Yes.
Okay.
Yes, for both medical and cosmetic reasons.
Oh, cosmetic. Tell us.
So it's funny, they say, men getting Botox is Brotox.
Right.
Yeah. Like, they're concerned about how they look. They really are. They, new in business, and they don't want to have bad skin, and they don't want to look older.
Right. So that's
It may
the
be
whole
hard.
thing.
They
It's
may
like
be
aging, right?
Yeah. They have to stay on their game too.
Right. So, I mean, you've been in this business so long. What
Yes.
is the one thing, is there any misconception about people taking care of themselves and skin that you would want people to know?
I think maybe it's just that people don't realize how much can be done. And I hear sometimes when people are unhappy with their appearance, they'll be like, I'll just wait and then I'll get a facelift. And I just want to say, poor skin stretched tightly is probably the worst thing you could want. Like, have great skin. And then if you have wrinkles or like gravity is taken, it does. But and you can decide, I'm not anti-surgery, but take care of your skin. That is going to be the most youthful thing you can do. And there are tremendous things that you can do. You don't need to be unhappy and say, well, I inherited bad skin and, I'll just wait. There's so much. Yeah.
Okay, so much people can do
Yes.
to not only look better, but to feel better. Because you
Exactly.
mentioned confidence at the beginning, and that is a huge thing.
And confidence isn't only about teens.
Right. It's about everyone, I think.
Everyone. Yes.
Okay, so how accessible are you? Are you booked for new patients?
So that's really interesting. That's one thing that, in general, dermatologists are really booked out. I mean, 4 to 6 months, you'll hear that. We really made an effort to keep spots in our schedule every single day.
Really?
So that we could work people in, not just new people, but, an urgent concern. And it doesn't necessarily mean, urgent to us, like, are you bleeding and blistered? It could be urgent to that person.
Right.
So it's not always that day, but we really
That's
work
awesome.
hard to get people in because that's how we can make a difference. And also, I don't want them doing other things.
Right. They might go to the drugstore and buy something worse.
Teenager listening to their friends, and there's hemorrhoid cream on their face and toothpaste on their face and all that, or
a potato
hummus on their face. And so we want them coming in. Also, with skin conditions, people go to urgent care. Again, urgent care has its place. I'm not opposed to it. But if you've got an abscess, you've got a laceration, we can do that. And poison ivy is a great one. I'd rather see that right away than to see you after you follow the instructions of urgent care, but then it's flaring like 3 days later or whatever. I want to see people right away.
Okay.
It's more efficient and just better care.
Right, for sure. Well, thank you so much for talking. How do people get in touch with you?
Our office is Northwestern. And we have a website, and so Dr. Wendy Sadoff or wendysadoffmd.com is the website. And then, of course, the phone number.
All right. Well, thank you so much. And do you want to give me the phone number?
248-855-3300. I don't call it often, so I had to think.
You're like, oh, that was the toughest question of all.
Yeah, go online, and and just getting back to, I know we've talked about this before, but what's on social media and things. Initially when Google and all this access to information came out, there was a thought that doctors would say, don't go on, Google, don't Google this. I don't want your degree from Google University. And I think that's not the right approach. I think, why would you have someone stay away from the greatest source of information ever?
Right.
But I say, bring it to me, because a lot of times it does not pertain to you, or it's frightening and you don't need to get all worried. But so a lot of it is shared decisions, shared information. So we're there for you.
I love that. Thank you so much.
Thank you.
All right. So I have been chatting with Dr. Wendy Sadoff, and of course her office is in Farmington Hills, and just another incredible example of women leading with expertise and also heart. So thank you so much, Doctor.
Thank you.
I appreciate it. Thanks so much for hanging out with me for our Women in Business segment. And if you know a woman who has her own business and should be put in the spotlight, let me know. You can tag me on social media. You can even DM me, or you can email me, and you can send that email to hello@brookeallencommunications.com. I know, a long email, but really, it's amazing to get the word out and to make those connections, and who knows what might come out of it, because when a woman uplifts another woman, magic can happen. We'll see you soon.